We now move ahead with the program, and at this moment, I'd like to call upon Dr. Amrita Shrestha, the Palliative Care Services Lead, INF Nepal, to kindly chair the session. And along with her, we have a virtual chair as well. So Dr. Andy Cordell as well, we'd like to welcome both of them to chair the next session, or the first session for the international conference. I wish you a wonderful time of learning and wonderful time of collaborating. I'll see you in a while. In the meantime, all the best for the first session today.
Good afternoon, everybody. Thank you very much, Mahima. I'm standing up so that everyone can see me at the moment, but I'm going to sit down now. So as we start our session today, I'd be grateful if everyone could switch off their mobile phones or maybe put them on silent mode, because we're going into our scientific sessions now. Our first presentation this afternoon is a video contribution by Dr. Ruth Powys from Australia. And she's really worked hard to establish the palliative care unit at Green Pastures Hospital, and is one of the key individuals in the project, along with Dr. Dan. I cannot think of a better person to be presenting about the history of Sunita project rather than Dr. Ruth. And she's here with us virtually as well. So let's watch what she has to say. Thank you.
Namaskar, namaste, sabailai. Yes, UK AIDMAT Sunita project, Kusamelan, palliative care for all in rural Nepal, leave no one behind, live international conference. More distinguished guests, INF Nepal, Haryakarka co-leadership, Sunita project team, and all those who have partnered with the Sunita project, contributing to the significant results and achievements of this project. Namaskar, namaste. I'm Dr. Ruth Powys, retired palliative care medical specialist, privileged to volunteer in Nepal over many years, and Dr. Amrita and the conference organisers have kindly asked me to share some of the history of the Sunita project. I'm thankful to God for his hand in leading and providing opportunities for early palliative care development in Western Nepal, which has been the foundation for this project. I wanted to acknowledge the key role of Dr. Kathy Ratcliffe and EMS International through their commitment to palliative care development in various countries, including Nepal, and their support for research and palliative care development in Nepal since 2014. The research completed, the needs assessment and the post-earthquake work gave helpful evidence which contributed to supporting the development of the National Palliative Care Strategy for Nepal. The funding of early low-key palliative care work at Green Pastures Hospital by INF UK, employing and training staff, as well as providing palliative care education and training in the community, meant services in Pokhara community had started to develop, and significant expansion became possible with the completion during the COVID times of the palliative care integrated with chronic disease buildings, which included a 14-bed unit for adults and children, funded by the Macleay Foundation through EMS International. It was just before Dasai, the Dasai holiday of 2019, when EMS International sent an invitation to their palliative care partners to submit within a week a one-page proposal for a UK aid-matched palliative care project. The concept of the development of a centre of excellence in Western Nepal, clinical, research, training and education, plus the development of an evidence-based rural model of palliative care empowering government and local communities, had its roots in previous unsuccessful funding applications. There were, I think, 4 major steps in the submission process, and then we heard that the project was accepted. On the 1st of April 2022, the Sunita project commenced, and the development of palliative care clinical work and education in Pokhara got underway. However, a changed context meant delays with permissions for rural work. The rural component, which is such a key part, was only able to get underway in the second year of the project, and the team has done an amazing job completing so much work and achieving targets. The Sunita project has achieved so much. The team has responded to many challenges and adapted plans, but remained enthusiastic, committed. There have been many expatriate volunteers who short-term and long-term have had significant contributions, too many to mention individually, but Dr. Dan has had a central role, as well as Dr. Josh and many others. Thank you to you all. Dr. Amrita, who has led the Sunita team and the paediatric development work so superbly, and Vishnu Giri and the senior team who've done an amazing job. Thank you. It is just fantastic to be able to gather together for this international conference, Palliative Care for All in Rural Nepal. Leave no one behind. To hear so much more of the outcomes, insights and learnings from this Sunita project. Namaste, namaskar.
Thank you very much, Dr. Ruth. And if you're still here with us, maybe we can have you on the screen as well. Many thanks to you. Many thanks to you for your contribution to the work that we are doing today.